Good evening, everyone, and welcome. Thank you for joining us as we wrap up the Immune Deficiency Foundation's Decoding PI series for 2025. Our featured speaker for tonight is Dr. Roger Arce from the University of Texas at Houston School of Dentistry, who joins us to discuss primary immunodeficiency and dental health. My name is Emma Mertens, and I'm the Program Manager for Education here at the Immune Deficiency Foundation. On behalf of our organization, we thank you for tuning in to this virtual event. Throughout this series, guest speakers provide a deep dive into clinically advanced topics from the world of PI. If time permits, the session will be followed by an audience Q&A with our presenter. In offering these programs, we aim to engage and empower the PI community through education. During portions of tonight's talk, we will offer audience polls. When a question pops up on your screen, you may submit a response by clicking one of the presented options. Also, a reminder that closed captioning is available. This webinar is made possible by our wonderful sponsors. It is due to their partnership and contributions that we can provide programs like this for the PI community. Please join me in thanking our sponsors. Before we get started, a brief disclaimer. Please remember that information presented during this meeting is not intended to be a substitute for medical advice, diagnosis, or treatment. We are here today as a trusted source and friend to provide you with information. Always seek the advice of your physician or other qualified health provider with questions concerning a medical condition. Never disregard professional medical advice or delay seeking it based on information presented during an educational event. All right, we're going to kick things off tonight by asking you to answer a quick question using the Zoom polling feature. We'll give it about 30 seconds for everyone to go ahead and answer. And our opening question is, please rank your level of awareness of how immune dysregulation impacts dental health. Awesome. All right. Well, it looks like we have a good mix of levels of learning and understanding in the audience. So hopefully everyone gets a lot out of tonight's webinar. Thank you everyone for putting your feedback in the box. All right. And with that, I am so pleased to introduce our speaker for this evening. Dr. Roger Arce is a board-certified periodontist, Harold Amos Medical Faculty Development Program Scholar, and diplomat of the American Academy of Periodontology. He joins us tonight from the UT Health Houston School of Dentistry, where he serves as an associate professor of periodontics. Welcome, Dr. Arce.
Thank you, Emma, so much. Let's start working on sharing my screen. Okay. Can you see my screen now?
Yep, I can see it. And then if you go ahead and, yep, you're good to go. Perfect.
All righty. And the mic is good? Sound is good?
Yep, you sound great.
All right. Thank you so much, Emma. Thank you for putting this together. It's been a pleasure getting to work with the foundation. I didn't know about its existence. And one of those things in which the foundation is pretty active in reviewing the information and all of that. I did have a couple of publications on primary immunodeficiency. And to my surprise, they came back because I haven't been, to be honest, I haven't been active in the field for a while. But I was able to contact with Emma. She's been fantastic in putting things together. And I was so pleased to hear about the foundation's mission and the goals and the knowledge sharing on all of these things that are going to be very important for the patient. So I've been honored to being asked to be part of the foundation. I look forward to playing an important role in the upcoming activities with the foundation. Okay, so as I'm indicating, I'm in Houston, Texas. So greetings from Houston. We had a very nice weather today. It was 66 degrees. So that's probably as cold as it gets around here. Sometimes it can get colder, but it's been very nice. So I'm saying hello from the Texas Medical Center, which is a large, it's known to be the largest in the world. I'm not exactly sure where that's the case, but uh, people here are very proud. They say it's the largest medical center in the world. We have to check on the square footage of that and all that, but I can tell you it's pretty big, and there's plenty of medical institutions and all that, and the University of Texas Health Science Centers being part of that. And then I am showing you here my place of work, which is the School of Dentistry. It's in the south part of the Texas Medical Center. So this is where we see our patients of all dental specialties. We have all of the dental specialties in the building, and of course, in my department, we're focusing on periodontal disease and gum disease, and this is what we're going to be covering today. So hopefully, we're going to be able to have a presentation based on regular questions and their answers. So we have this a little bit more interactive, and sometimes we, academicians and scientists would like to go a little bit into the details, but I wanted to just to make sure that my slides were to the point, and they had a strong take-home messages, which I'm going to be reinforcing all the time as we go through the presentation. So as simple as they can be complex too. But if you have questions, please, at the end, we're going to have a good time to address some of them. And my primary role as a clinician, dental clinician, and a scientist is to give you my best educated guess on the topics. There may be some particular questions I'm not qualified to answer, and that will be okay. But I promise I'll do some research on that. So I'll write it down and get back to you. But the important thing here is that we have a good time and that we understand the take-home messages that we want to convey during the presentation as to why this is so important. So why the primary immunodeficiencies affect oral health? So it's simple, and I think that you're familiar with the concept of reduced ability to control microbes in the mouth. That also applies for your respiratory system, which is the most common site of co-infections with patients with primary immunodeficiencies. Also the GI tract and things like that. But the mouth is going to be a very important place because if you think about it, everything is going to pass through the mouth. That's what we used to eat. That's what we used to talk. So we're in constant interaction with the mouth and the environment. And of course, as you can imagine, we're going to have a lot of bacteria in the mouth. I mean, the evidence for that is that maybe if you forget to brush your teeth at night, the day after morning, you're not going to have such a wonderful breath, right? It's going to be bad breath, and you probably wonder, well, what was happening? I only forgot to brush my teeth. Well, the bacteria took over at night and just they overpopulated your mouth. And when you have bad breath, that's the most obvious evidence that we have a lot of bacteria in the mouth. And that's the reason why in primary immunodeficiencies, we are going to have an effect on trying to deal with these bacteria. Not all the bacteria are bad. We actually need a lot of good bacteria in our mouth to process a lot of nutrients that we need from them, especially, for example, nitrates, which are going to be very important for our cardiovascular function. So we need the good bacteria, but we also have to control the bad bacteria, the bad bacteria, because they're going to be bad for our health. And that's why even if we have a primary immunodeficiency, that's going to be even harder for us. Okay. And of course, the issue of having higher susceptibility to other infections is not only going to be related to bacteria, but we also have fungi. We have fungi in the mouth. So namely, the best example is Candida albicans is name. And you all heard about candidiasis, or the most common way of knowing candidiasis is thrush. So plenty of you probably have heard or have experienced, unfortunately, this type of situations. And viruses also play a role in this dysregulation of bacteria and the interactions with bacteria and fungi. So viruses are also going to be important in the primary immunodeficiency patients because you also can have those having a toll on the patient's oral health. Okay. So again, so just to recapitulate what we're saying is that the primary immunodeficiency is gonna reduce our ability to control those microbes and increase our higher susceptibility to other infections. And that's gonna definitely affect the oral diseases because we have plenty of microbes. And when I say microbes, it's not only bacteria, it's also fungi, it's also archaea, it's also viruses. So it's just microscopic microorganisms, right? And they're going to facilitate oral diseases. And there's a connection in the mouth with the oral health. We've been doing a lot of research in the past 20 years connecting good oral health with good overall health. So things are not disconnected. I don't know at what point the dental education sort of like went so specific to dental and the medical education went so specific to medical, but there's no bodies without a mouth and there's no mouths without bodies, their respective bodies. So it's very important to always understand that everything is connected. So if you have an overpopulation of bacteria in your mouth, you can rest assured that that's also going to affect your local microbiota, and that's also going to affect your respiratory microbiota in your lungs, and that's also going to affect your gastrointestinal microbiota. So you keep hearing, for example, about these topics in the press, in the news about the microbiome. And so we have an oral microbiome, and we have a lung microbiome, and we have a GI microbiome. And these things are incredibly interconnected. They're not independent from one each other. And there's plenty of research and evidence suggesting that if you start having these regulations of things that happen in your mouth and they're going to affect the microbiota, the microbiome in your mouth, you're definitely going to have an effect on your other microbiota in the body. And that can lead to consequences that can lead to facilitating other type of diseases and complications. Okay, so let's answer some questions. So, are individuals with primary immunodeficiencies at higher risk of oral disease? So, you can guess, right? Unfortunately, that is the case. And there's definitely a lot of clinical evidence suggesting, and probably your own experience, that you've had it and that you have to deal with this. And there's basically three things that we always have to remember when it comes to that high risk of disease. You're going to have more inflammation. Okay, so you can picture inflammation as swelling. So you're going to have some examples in there. I hope they're not too gross or too graphic. My apologies if if you feel that way. Just make sure you close your eyes. You don't see that stuff. It's not pretty, but I just wanted to create, to give you real life examples. So you're gonna imagine swelling, right? Swelling of the gums. So if your gums are puffy and your gums are bleeding, you probably are experiencing a complication. That's not normal. That's not supposed to happen. And we're going to have good examples about that. And ulcers, in difference from what the swelling, the inflammation in the mouth is, usually inflammation doesn't have any pain with it. There's discomfort, but there's no pain. Whereas, in contrast, ulcers are extremely painful and uncomfortable. When you have them and they're uncomfortable, and if you have dentures, they can drive make your life miserable because it's so uncomfortable and you're irritated. And those ulcers can be inside the mouth, or they can be on your lips, on your face. So there's so many places, and you can have different types of ulcers and different kinds of viruses associated to those ulcers. So we're also going to have some examples on that. And gum disease, which is what I work with all the time as a periodontist, we always are taking care of the tissue surrounding the teeth. So perio is surrounding, right? Dentist is the part is the teeth. So surrounded the teeth. So namely, it's gonna be the gum tissue, the pink tissue, right? And it's gonna be the bone supporting the structures of the teeth. So the anchoring structures of the teeth. So you're gonna have the bone and you're gonna have the pink gum tissue. So all of those are going to have consequences when it comes to patients on primary immunodeficiency problems. Okay, so you don't have to be a dentist to know that something is off in here. So we have on the left a very healthy situation. So your gums should be coral pink. This is how we describe it. So very, very pale, and you shouldn't be having any redness or swelling. And if you can compare this to this situation over here, You see, for example, that you have blood. So blood, it's at the early sign of swelling or gingival inflammation, and namely, as we call it, gingivitis. Bleeding through your gums is not normal at all. Don't let anybody tell you otherwise. If you're bleeding through your gums, that's a serious issue. It's not to be considered something, oh, it's not a big deal. Yeah, sometimes if you are healthy, but you happen to have eaten something that got stuck in there and you're cleaning it, and you probably overdid it and you create a little bit of trauma and that led to a little bit of bleeding, that's occasional, that's fine. But for example, if you're brushing your teeth and you see blood on your toothbrush, that is not normal. That is not normal at all. That's not a normal situation. That's something that you have to go and seek help immediately. And the thing with these diseases, in terms of the gums, they're very silent. They don't give you pain. So, for example, if you ever had that experience in which you're brushing your teeth and then you notice the blood, right? And then the taste of the blood and all that, but usually if you clean very well, it goes away. That didn't give you any pain at all. Imagine if it did give you pain, you will go to the dentist way quicker than you were planning on doing it. Because, yeah, I hear it all the time. Patients, the first thing they tell me is they hate the dentist. I have to deal with that because of their life experiences. And they're, when they were little kids, they were not treated the right way and they have these traumas for the lifetime. So I always, have the best attitude I can have with my patients, but they always tell me, I don't like being here. I don't like the dentist. Or we have to deal with that all the time. But we usually convince them otherwise, and they ended up loving us and coming to our help and our care quite frequently, and it becomes a very nice relationship. So yeah, again, so if you see this is not normal, and you can see how puffy the gums are. Puffy gums are not normal. Something is going on. So you have to make sure that feel free to, in your mirror, take a look, move your lips around, right? Nothing wrong with that. And make sure when you clean your teeth that because you don't have any pain, it's very silent. So feel free to just go and look and make sure that they look very pinkish and that you're not seeing any evidence of bleeding like this. That's going to be very useful as a self screening type of tool to make sure that you're not having any issues going on, because this is very silent process. It doesn't give you any pain. If it did give us pain, we probably will have an early intervention, because there's pain, you're going to look for help. Usually, when there's pain in dentistry, it's because it's kind of late. It's either because your teeth are wiggling, they're moving too much, and they're uncomfortable, so the gum disease is way more advanced. Or, for example, in the case of tooth decay, when you start having a toothache, it's probably because it's been years of activity with the decay going through the layers of the teeth and getting to the nerve. So it doesn't happen immediately. It takes a long time. So this is the very chronic diseases. Okay. So let's come back to some important questions. So why dental issues are common in primary immunodeficiencies? Well, as you can imagine, and you've been learning about this a lot, there's impaired immunity. So your cells are not working the way they're supposed to, or you don't have enough of a very particular type of cell. So that's going to be the effects that the immune system doesn't have the right tools to fight off this infection, right? And even in patients that don't have primary immunodeficiency, that's the way it works for gum disease. For example, we have some patients that will never brush their teeth in their lifetime. Like they've never seen, not here in America, but worldwide, they've never seen a toothbrush in their lifetime, and they have very little gum disease. That means that their immune system is able to get to a stage in which is self-controlling. And despite the fact there's a lot of plaque, a lot of bacteria, because there's not toothbrushing, there's not the disease process taking place the same rate. And quite unfairly, we have the other side of the coin, in which you have patients that brush their teeth very good, very diligently, and they deal with periodontal disease all the time because their genes make them prone to have gum disease. Even though they may not be primary immunodeficiency patients, their genes, their genetic makeup makes them susceptible to see just a little bit of bacteria and overreact to that bacteria and cause gum disease. So you have the wide array of patients in that a spectrum of no brushing, no gum disease, and brushing a lot, and you have gum disease. If you add to that primary immunodeficiency, of course, if you have impaired immunity and your cells are not working the way they're supposed to, well, you are going to have a losing battle right from the get go because you don't have anything to defend against the bacteria, which were always going to be there. No matter how good we brush our teeth, how frequently we're cleaning our teeth, we're going to have bacteria all the time. Just to give you an example, it only takes 5 minutes after a good brushing of the teeth for the bacteria in the mouth to reattach to the teeth and start forming plaque again. 5 minutes, and that's it. So they're always there. They're supposed to be with us. We're supposed to cohabitate and be happy together with them, but not let the bad guys, the bad bacteria. I'm going to give you some examples of what those bad guys or bad bacteria are. Um, they're going to always be there with us. We're not going to be able to get rid of them. But our immune system tolerates them in patients that have the genetic makeup to do so. If you have impaired immunity, you're not going to have the tools to be tolerant to this bacteria. So you have to have special care, and you're going to have a more active role in being proactive in terms of prevention of the disease, just to make sure this is not going to happen. The other part of the picture in here is that, as I was saying before, this inflammation is very chronic and it doesn't give you any pain. And that inflammation being chronic because you have impaired immunity, so you have an accelerated rate of tissue damage and persistence of the infection because there's no immunity to defend you against those bacteria. So you're going to be prone to having that tissue destruction and that persistence of bad bacteria. You're not going to have enough tools to fight it off, and that's going to be a little bit more complicated, and that's why your treatment has to be tailored to your specific needs. So take a message, right? The cells are not working properly, and the infections in the mouth are very chronic, and they're very persistent, and they're very stubborn, and they're always there with us. It's up to us to try to impair their growth and have better tools to cohabitate each other with each other. Okay, so look, this is a periodontal disease patient. This is not a primary immunodeficiency patient, but this is a typical periodontal disease patient that has a very chronic condition. This patient never complained about pain, but these conditions can be so destructive. You can see here that the gum is so destructive in here that you can see that the tooth looks longer, and this tooth right here is going to be wiggly and it's going to be moving a lot upon function. So those teeth, when they get at that stage, they cannot be saved. It's too late to do anything about it. And then you can see the plaque accumulation in here because this patient is scared because there's so much bleeding. So the patients don't know what to do. And then you get to see very clearly the redness of the inflamed tissues. That's inflammation. That's not normal. That's not supposed to be there. Look at this. This is the calculus. That's the calcified biofilm bacteria has been growing during this time, and it's getting even tougher to clean and tougher to protect. So even a regular toothbrushing wouldn't be able to treat this tooth because now the biofilm is so ingrained into the tooth that you're not going to be able to even brush it and clean it. Now we need to seek professional help, and we're going to have to use those tools in dentistry that make weird noises and they're not comfortable. Sorry, yes, that's the only thing we have. We have to use those tools to make sure we're going to be able to remove that biofilm, calcified biofilm, namely the tartar or the calculus, to be able to try to get you to a reset of your microbes and the bacteria, the bad bacteria, and get you to a healthy situation. So you can see here tartar accumulation, inflammation, recession, bone loss. This is a very destructive process. And look at this, it's painless. Patients don't feel pain, they feel discomfort because their teeth start wiggling. So imagine you're eating and your tooth is wiggling and you can move it with your tongue. It's kind of a weird feeling, but then it's not giving you pain. Let me reinforce that because that's usually what happens. Patients don't pay attention to these situations soon enough because it doesn't give you pain. It's painless. Okay. So when you notice your teeth wiggling, that's kind of too late. We're going to have to extract that tooth because we're going to have very little tools to try that to save that tooth in your mouth. So it's very important to understand those features of gum disease, which is very prevalent in primary immunodeficiency patients. Okay. Okay, so this picture here is kind of gross and it's AI generated. So this is not real, but what I'm trying to showing here as an example is imagine if you had a huge ulcer in your hand. You will see it and it will be painful. You will know that you have something bad in your hand. But when it comes to the mouth, you don't see it unless you go and look. You don't see it. So it's very silent. You don't see the ulcer in your mouth and you're not having any pain. So, can you understand the parallel I'm trying to make here? If it was in your hand, you will know something is going on. You will go to the doctor. But because it's in the mouth, it's hidden, you're not seeing it, you're not paying attention to it. Well, let me tell you, if you were able to get the gum tissue out, all the surface area of the gum tissue, and put it on your hand, it will be equivalent to the palm of your hand. That's what the graph is trying to show you. It's a made up graph. It's AI generated. It's not real, but it's trying to get you to understand a point. Your swollen gums, like we saw in the previous patient, if you were calculating that area of swelling and ulceration with constant infection and influx of bacteria, that will be equivalent to the palm of your hand. Can you picture that? Could you imagine how big it is? We sometimes think, oh, gum tissues, they're so little, they're there, they're not doing anything. They're doing a lot. They're doing a lot. It's very important. And imagine if you had that ulcer over here, you have it, but it's not giving you any pain. You don't see it. But if you were seeing it and having it in in your hand, in the palm of your hand, you definitely do something about it. So this is how important it is. The gum health is so important because if you don't pay attention to it, you have that swelling and that inflammation all the time. That's when the problems are going to start happening because you're going to be susceptible to that bacterial influx. Remember, we discussed the bacteria are there all the time. We're not going to be able to get rid of them. And they're going to be just acting in there without you even noticing. You're not seeing it. So, swollen, ulcerated gums in terms of surface area is equivalent to a big sore covering the palm of your hand. And that's something that I want you to get in your head so you can also tell your family members and you also can tell your friends bleeding gums are not normal. Their ulceration is evidence of ulceration in your mouth. And you don't pay attention to it because it doesn't give you any pain. But now that you know, you're gonna be like, your gums are bleeding. That's not normal. You better go to the dentist. That's gonna be something to pay attention to. Okay. And why this gum disease happens? Well, it's multifactorial. So you can see here that the bacteria forms this tartar and biofilms below the gum line. So the gum line is here, and this is where they love to thrive in here in this area. And why is that? Because in this area, there's less oxygen, and these bacteria love the absence of oxygen. They're called anaerobic bacteria. And the bad guys are these guys over here. We culture them in the lab. This one is called Actinobacillus actinomycetes comitans. So if you learn how to say that really, really quickly, I'll make sure we get you an award. Actinomycetes comitans. You have to learn how to say it very quickly. And then Porphyromonas gingivalis. These are the bad guys. When we culture this in the lab, we intentionally make the students, dental students, go to the lab and smell this. This smells like rotten egg. This smells like death. It's horrible smell. That's the stuff that is in your mouth. It's very nasty stuff. It's very nasty bacteria, okay? And then these biofilms get into your tissues and they create these ulcerations. Remember, we were talking about the ulcer in your mouth? This is what's happening all the time. Those bacteria, with their biofilm protection, because they're full calcifying tartar, then they're going to be challenging, infecting, creating bleeding. If you're bleeding, it's because you have ulceration. You broke that barrier that protected you from bleeding. And why is bleeding? Because you're having this local inflammation, and the inflammation comes with dilation of the vessels to facilitate migration of the immune cells to fight off the infection. That's why it's so easy to bleed when you have an infection, because your blood vessels are fat, trying to facilitate the migration of those cells to fight off the infection. The body is just trying to defend itself from these biofilms, from these bacteria biofilms. And what ultimately happens? Well, you don't have to be a dentist, but in here, your bone should be way around here, but you start seeing this destruction of bone. Why? Because first is your pink tissue, your gum tissue is trying to fight off the infection, but now your bone tissue is sort of like giving up and it's trying to run away from the infection site. And the way the bone tissue does run away from the infection is by creating resorption. The bone gets resorbed. It gets sort of like melted away. It runs out of the infection. That's the reason why you lose a structure of support, and then you start having wiggling teeth because they're going to start moving because they no longer have support. And then we have the situations in which we're doing surgery trying to fight off the infection locally. And then we have a very compromised tooth over here. As you can see, this is not normal. Your bone should be covering this, your gum tissue should be covering this. So that's an advanced stage of the disease process. You never have pain with it. It just so happens that you're susceptible to the gum disease, and this is the way it's going to play out. Okay. Okay. So the immune system and the mouth interactions never stop. Okay. As we're discussing, they're not going to go away. We better get used to them. They're there. We actually need them to some extent. The good bacteria, we need them. We cannot have the bad bacteria. So look at this. These are beautiful images. This is from the microbiology perspective, beautiful bacteria associations, and we are able to sort of label them under the microscope and look at those formations of biofilm, because people are trying to come up with products that fight off this bacterial formation in a better way, more efficient way. And we have good products that help, but this does not replace professional cleaning. You still have to have professional cleaning because biofilm formation is really hard to fight off. No matter how much advancement we have in science, we haven't had or come up with a product that's going to be able to fully control the infectious process from the bacteria point of view. People ask me all the time, Doc, but I use Listerine, just a brand, a mouthwash all the time. Why I'm getting this? Because I'm supposed to be fighting, killing all those bacteria all the time. Well, it doesn't work that way, because remember what I told you. After you do something and you start eating, or even just not eating, after a while, your bacteria is going to come back and colonize. You have saliva in there facilitating the colonization process. It's just going to happen. Might as well get used to it. But we have ways to fight it off. And this cartoon over here is showing you healthy situation, right? We call symbiotic biofilm, which is the biofilm that is very healthy. And then we have homeostasis, so we can tolerate that. So that's the reason why we don't have to brush every hour, right? But if we brush, hopefully 3 times a day, but acceptable 2 times a day, uh, we have some level of tolerance with those good bacteria. But if we don't brush for a day or two, you probably will experience the bleeding we were talking about. And when that happens in patients that are susceptible to disease, you're going to start having all this infection now affecting and destructing your bone. So you see how your bone in here is healthy, and parallel to it, you see how it's getting destroyed, and you're getting the ulceration in there. That's when the problems start to happen. Okay, so now that we have an understanding of what the concept of gum disease is, now we're going to start getting into the specifics of some examples of what the innate immune defects are, right? So you probably have heard this before. Coming back to it, you have uh, two types of main immunity or immune mechanisms that you have. The innate immunity, which is your cells fighting off the infection, and your adaptive immunity, which is more the antibody mediated immunity. So learning from the infection process and creating your own antibodies. But when you have primary immunodeficiency, that process is going to be affected on both levels, on the cellular level or innate immunity, and on your adaptive immunity or your antibody creation to fight these infections. Okay. So let's cover first the innate immunity part, okay? The cells, okay? So the most common example for this part are the neutrophil dysfunctions. Neutrophils are so important in controlling gum disease. Remember when we were saying that the blood vessels dilate to facilitate that migration of the cells from the blood to the local site, the gum. If you don't have neutrophils, you're losing such a good, an important battle, because neutrophils are the first line of defense with invading microorganisms. So they are forming that biofilm, they're getting protected by that crust of tartar, calcified biofilm. And on top of that, they're shedding bacteria that is invading your gum tissue, it's creating that ulceration. And you're trying to fight it off, your body's trying to fight it off, but you don't have neutrophils, so you're going to be in a disadvantage because you don't have very important cells that are going to start fighting off the infection. So the typical examples of these situations are the leukocyte adhesion deficiencies, or the LADs, the severe congenital neutropenias, or the SCNs, and your cyclic neutropenias. Those are the most common um, scenarios in which you have cell mediated impaired immunity. Your neutrophil dysfunction is going to lead to severe gum disease. That usually happens very early in time. So, as we learn with these patients with primary immunodeficiency, uh, the first signs of early gum disease happen when they're just kids, very early stages of life. Swollen gums, candidiasis, fungal overgrowth, and things like that are going to be red flags that something may be going on. Okay, so let's see some examples. So, for example, in here, leukocyte adhesion deficiency. So, you have ulcerations. This, for example, can happen in your genital areas, your cheek and petago, and look at the level of swelling that these kids have around their teeth. It's very obvious, it's very massive. That kind of inflammation is not normal to what the normal immunoproficient patient is. They can develop that inflammation, but it's not so overt. But it's just like what we were saying, because you don't have the neutrophils fighting for you, or your leukocytes in this case cannot roll over and go from the blood vessel to the site of infection, they're going to be prone to this type of situations. And many of these patients lose their teeth in a very early stage. They can be losing their primary dentition and also their permanent dentition. When it happens, it's really hard to treat, and especially because it happens in such an early age. Okay. This is an example, for example, how horrible severe congenital neutropenia can be. So these patients can have persistent ulcers in their mouth. They can get candidiasis or the fungus overgrowth. They can get abscesses, local abscesses. Sometimes they even pop them up by themselves because it almost looks like a pimple. So these patients are popping up their own abscesses. But the periodontal destruction is so severe that it's very common for these patients to lose their teeth in a very early stage of their life. Okay. And then the cyclic neutropenia, as the name indicated, is a period of exacerbation in which is cyclic, and then periods of remission. These patients get also a lot of ulcers, and there's a little bit of healing when the cycle is not active. But when the cycle is active, it can create this level of inflammation, and it can also lead to tooth loss. So also very difficult to treat as well. Okay. These are other examples of innate immunity, or your cell mediated immunity in these cases, of situations, of cases in which we have other syndromes that can play a role in this. For example, in here, we have chronic granulomatous disease, or this is known as Wegener's disease. So this Wegener disease comes with mucosal alterations or ulcerations, gingivitis, and periodontitis. Celiac Higashi syndrome that comes with ulcers, candidiasis, and early aggressive periodontitis. We no longer use the early aggressive periodontitis term anymore, but what that means is that it's very, just like you can picture from the name, early because it's an early stage of life. Remember, we talk about how chronic these diseases are supposed to be. So you only notice the teeth wiggling when you're in your 40s, for example, commonly. But in early stage in your life, when you're in your teen years, you're having these type of situations, or even in your primary dentition when you are like 6 through 12, that can be starting affecting your teeth. That's going to be a problem because that's going to lead to a very early onset, aggressive because it's very quick in causing the problem, periodontal disease. Papillon-Lefebvre syndrome, which comes with very severe early periodontitis. We have some examples, leads to early tooth loss. And APS1, which is comes with oral candidiasis and some developmental defects in your teeth. They're called enamel hypoplasia. Your teeth look like different. I intentionally didn't include those for the sake of time. I wanted just to focus on the gum disease. Okay, so we're gonna have some examples in here. So this is Wegener's. So you can see the inflammation, ulcer patches. It can happen in the palate, in the cheeks too. Very destructive disease. It also can come with swelling of the lips. This is Celiac Higashi syndrome. You can see the inflammation is not normal. It's very aberrant. It's very aggressive. Very abnormal conditions. And your Papillon-Lefebvre syndrome that comes with other manifestations for diagnosis is the palmar keratosis. As you can see here, manifestations of your skin, the palm of your hand, of the palm of your teeth, and also periodontal disease is part of the classification for Papillon-Lefebvre syndrome. As you can see here, you don't have to be a dentist to know that that doesn't look good. You see the teeth don't have any bone around them, right? They're almost like floating in there. It's very common for these patients to lose their teeth, unfortunately. Okay. Now let's discuss the adaptive immune defects. So remember, adaptive now is related to low antibody production or deficient antibody production or deficient antibody quality or efficiency of the antibodies. These patients are very prone to infections and ulcers. So you have, for example, your common variable immunodeficiencies and your BTK deficiencies. Where they're X-linked or XLate linked. So let's see some examples on here. So that's the common variable immunodeficiency. These are more localized, it's not as massive as the innate immune mechanisms. Leukocyte common variable deficiency are more prone to complication of specific areas in the mouth. For example, this patient has in here bridges and crowns that may be difficult to clean, and that probably makes him prone to have more localized infections in this area over there. These patients also have a lot of higher fungal and viral susceptibility. We get higher rates of candidiasis and very frequent viral ulcers. Okay, so we have in here candida, as pretty as it can look at the microscope, is very nasty and difficult to treat, and is not fun to have. It's thrush patients is very debilitating and uncomfortable situation. And the viruses also cause these ulcers, especially the herpes viruses can create these ulcers that are also very uncommon, uncomfortable to bear. Okay. So this is, for example, pictures of the candidiasis. They can form these patches. Sometimes they can wipe off. Sometimes they leave a trace of inflammation. So when they do, and you can see like they're getting stuck in the tissue, they're the erosive kind. So they have to be treated with more potent antifungal medication that's treated in combination with the physician and the dentist. Or sometimes they have these patch looking type of thing in which they can be wiped off, but you need some mouthwashes, especially medicated mouthwashes that can treat the local infiltration of the fungi into the tissues as well. That a little bit easier to treat in that regard. The ulcer is very common, right? So you have your typical blisters that can happen, seasonal related, or people that have them know when they're coming because they start feeling a little tingly sensation. That's called the pandrome stage. And then a good trick to start treating them early is that you can apply salt to them because that dehydrates the process and delays the onset of the virus. You're still gonna develop an ulcer, but you shorten the time span. And there's also medication that we can use to treat this type of lesions, but they're very common and very, very recurrent as well. There's also some advanced situations of patients that are having primary immunodeficiency and can have susceptibility to other viruses. For example, Epstein-Barr virus, which is very related to cancer in the mouth, can also create this type of lesions, very nice lesions. That are very difficult to treat, and they require sometimes, because the cancer is so advanced in their stages, it requires resection. Unfortunately, they're very difficult to treat. So these are other type of viruses that can play a role in that we don't want to have. We always want to be very diligent and as to avoid the progression of the cancer, and the, better diagnose it in an early stage so it doesn't have to be as resective. Okay. So, of course, many of you take immunoglobulin therapy, of course, and IRT, and we want to know whether that's going to be a good thing to fight off the infection, right? You don't have antibodies to fight off your infection, so you're hoping that the medication is going to help you out fight off the infection. So, what is the impact on this treatment of these diseases? Okay. So, in reality, we're still learning because these medications are relatively new and they're improving, but we still need some more research. So we don't have a very well documented response in terms of the immunoglobulin therapy in helping us fight off infections. So we still have more evidence. We need to come up with more studies to really understand what's the real effect. But I can tell you that it's going to have a good effects as the preliminary data is suggesting. So there's a little bit of hope in there. So we don't have a well-documented evidence available in the medical literature right now because most of the literature is focusing on respiratory and systemic infections. So as dentists, we get to work and collaborate more with physicians. We can get there. But I found some preliminary reports that are very, very promising. For example, we have good evidence that uh, your microbiota in your lungs and in your GI tract gets better with immunoglobulin therapy. And we know that there's an association with bad bacteria and that microbiota. So you can infer that also by treating your adaptive immunity and helping you always have better antibody responses, you can have a decreased susceptibility to respiratory infections because your mouth is also getting better. If it wasn't the case, your mouth would be getting worse. So just by improving your local microbiota in here, you're improving your respiratory microbiota in there, and then you have better tools to fight off respiratory infections, especially in those patients we have low levels of IgA and IgM levels. This relationship appears bidirectional, and the dysbiosis part, which is that disorganization of bad bacteria causing disease, uh, is causing the respiratory problem, but the IgG is helping organizing get instead of dysbiosis, is helping to create more symbiosis, which is a little bit more hopeful in that regard. So even though we don't have the clinical evidence to say this is the case, there's some clues that is suggesting that that could be the case, and we have to propose research to really demonstrate this. We know from research and even reports that I've been able have the pleasure to be part of, in which we have analyzed the effects of oral and GI tract microbiota and how everything is connected. So again, it will be crazy to think that that big ulcer in your palm of your hand wouldn't cause disease. That big ulcer in your mouth wouldn't be able to infiltrate bacteria and affect your GI tract and your respiratory tract. Everything is connected. And we have plenty of evidence to suggest that when you have a better oral health and control of your oral microbiota, you have good effects on the overall health and systemic health, including the microbiota or the microbiome of the gut and the microbiome of your lungs. So this is all connected, and there's so good promising evidence that that's going to be the case. This one is excellent, and this one is also very promising. The IVIGG that was administered as a mouthwash in a clinical trial demonstrated that as a mouthwash, just local application, 3 times daily for 2 weeks, reduced candidiasis infection susceptibility by almost 70 to 100%. That's very good. This is suggesting that the immunoglobulin that you can take is providing your local mucosa benefit when applied locally. So that's the citation in there, and 2018. So fairly recent evidence. So hopefully those products are going to be more available in the market, and local mouthwashes with immunoglobulin in patients that have recurring candidiasis can be treated with this type of situations. So that's almost also very promising. So again, we need more evidence to really, assertive say that the IRT therapy is going to help you out fighting off the infections, but there's good clues and evidence suggesting that that's going to be the case. Okay. But of course, we know that we're not going to be able to come up with a magical medication that is going to be curing your gum tissue. We're not going to be able to come up with a magical medication that is going to be able to control for that tartar formation and biofilm formation. And we're not going to have a magical immunotherapy combination that is going to just control these diseases. As we know from this lecture, there's so many factors playing a role, and that's why we have to fight this up from different fronts. Okay, so this does not replace oral hygiene. That means that you have to be extremely obsessed about keeping excellent oral hygiene, and it's not going to prevent plaque-driven diseases, because if you let the plaque to form, no matter even if you're a healthy patient or primary immunodeficiency patient, you're going to be susceptible for that problem anyways. So we always have to be taking care of that plaque formation. And especially in the primary immunodeficiency patient, we have to be even more diligent and more, quote unquote, obsessed about the situation, because it's very important. Okay. So how primary immunodeficiencies affect the oral health over time? Well, we have early onset of issues and faster progression of the disease. So remember when I was telling you there's patients that do not form periodontal disease and there's patients that form periodontal disease very rapidly. So the primary immunodeficiencies are going to pull you to the extreme of very early onset, very early destruction. That's why these patients have to be observed and monitored constantly. Okay. What are the common long-term patterns where you have recurrent ulcers and persistent inflammation? Okay, so that's why you have to be on top of things, and when they happen, you have to be very proactive in treating them. Okay, so how do we prepare for a dental visit in the primary immunodeficiency patient? So the first thing is to share information. So you have to share your lab results, your history of disease, and coordinate your dental visit with the immunologist and see where you are in terms of control of your disease with your immunologist, so you can move forward to the next phase of the dental treatment. Then sometimes you have to not only assess the stability of the immune condition, but also because you know that there may be some overgrowth of bacteria during the procedure, you're going to be more susceptible to the infections. There may be some situations in which we need to treat you with antibiotic prophylaxis. So we have to give you antibiotics in advance before your dental procedure, just as a layer of prevention to avoid that bacterial overgrowth in there. Okay. So during dental treatment, of course, we have to be making sure, many of these patients have a lot of pain, so it has to be gentle techniques. Of course, there's immunosuppression, so we have to have places in which we have good control protocols for enhanced infection control. And then after the dental procedures, which can be scaling and root planning, periodontal surgery, tooth extractions, and things like that, We need to closely monitor patients and make sure that we report and work on any potential complications very early in combination with the medical and the dental team. Okay. You have to become an expert in optimizing your daily oral hygiene. So at least brush your teeth twice daily. If you can, 3 times a day, even better. The most important time to brush your teeth is at night. Okay. So what I tell my patients that are susceptible to gum disease is little tricks like this. You never go to bed without properly brushing your teeth. My advice is that you brush your teeth right after dinner, because if you leave it when you are, watching TV, and then you're sort of like falling asleep, and then you remember you haven't brushed your teeth and you're gonna go like half sleep and try to brush them, that's not gonna work. You're gonna be so tired. The last thing you want to do, your body wants to do, is brush your teeth. You have to pay a lot of attention to this. So my advice is right after dinner, the first thing you're gonna do is properly brush your teeth at night. It's the most important time of the night. Why? Of the day. Why? Because during the night, your saliva levels are going to be reduced, and the bacteria love that. The saliva washes off the bacteria. When you go to sleep, your saliva level decreases and bacteria go to party on your teeth and on your gums. They love that. That's the reason why when you wake up, you notice your mouth is dry. Why? Because you were not producing any saliva. So then you know that I'm not telling you stories. This is real deal things. And that's why you wake up with the bad breath, because the bacteria took over and party all night long. Okay. So that's why you have to be very careful and know that you never go to bed without properly brushing your teeth. And what does that mean? Well, you have to floss first. Flossing is extremely important. Flossing is very important. Flossing is even more important than brushing your teeth. So flossing is so important. So you're gonna tell me I hate flossing, okay? I don't deal with that, thread very well, and it gets caught in some places, and I hate it. I get it. It's not easy, but you have to do it. You have to become very good at flossing, okay? What I would recommend is that if you have problems with your hand dexterity with using the floss, just get flosser picks. They're excellent. They're so inexpensive, and you can get really good at using them. Once you floss, I would strongly recommend you get a water irrigator. They're commonly known as a brand called Water Peak, but it doesn't have to be the brand Water Peak. It can be any brand. They're now very affordable. You can get a $20 version on Amazon. And why is so important to floss first? Because you're gonna get big debris out. And why is it gonna be so important to water irrigate this area? Because the water irrigation is gonna help you out flush the little debris. So it's going to be very important to do that. So the water irrigation is going to be essential as part of your care. Okay. And then after the water irrigation, you're going to be brushing your teeth. And if you want to become very good at this, get a power toothbrush, because the power toothbrush is going to do the job for you. You don't have to worry about moving up and down or left and right. You don't have to worry about that. And it doesn't have to be very expensive toothbrush, because you can get a $2,000 version that you don't need. You can get a $30 version at Walmart if you want, and you just put it in there. And because it's acting on itself, you just have to go on that tooth and count 1, 2, 3, and do a little jump and go to the next area. 1, 2, 3, and do a little bit jump and go into the area. So it's doing the job for you. You just have to make sure you learn very well how to position. But you first floss, then you water irrigate it, then you go ahead and brush your teeth with a good toothpaste, hopefully a fluoridated toothpaste. And if there's questions about fluoride, I'll be happy to answer those questions, because fluoride has a kind of a bad rep. We can talk about that. But that's going to be essential for your optimization. And of course, you spend like 30 minutes cleaning your teeth. Once you're done, Don't go snacking because you got hungry after you want to go to bed or because you're watching television. No, you spend too much time. There was so much time and effort. So no more snacking before bedtime or while you're watching television because you're going to have to start over. So once you have dinner, the first thing you do before anything else is that you properly brush your teeth because you never go to bed without properly brushing your teeth. And then you stop eating because there was too much work to go waste. You get me, right? Okay. All right. You can use mouthwash too. If you do, what we recommend is you do alcohol-free rinses because the alcohol or the burn, as you know it, can be affecting your mucosal tissue. Your mucosal tissue is so friable because you don't have the immune cells to protect you. So very gentle mouthwashes and fluoride products are going to be very important for your mouthwash. But I don't put so much importance on the mouthwash, to be honest, because we don't have the, it's not a panacea. It helps, but it's not a panacea. For me, the most important one is the floss, the irrigation, and the toothbrushing. Yeah, you can do the mouthwash, the water, the mouthwash. You can do if you like, but make sure it's not those burning sensation type of products. Just very gentle, okay? But you can also use salt water, and it has a good activity as well. So you don't have to do commercial mouthwashes. Companies are not going to like me for saying this, but there's evidence to suggest that. And of course, the most important thing as well when you snack, if you do go snacking on sugary diet, that's what bacteria are gonna love. And they love and thrive on that. That's why you get decay, right? So no sugar intake. If you happen to have a little sweet tooth here and there, which I do too, make sure you're brushing your teeth right after or having a good irrigator just to reset the bacteria that are gonna be forming in there. But you never eat sugar and don't brush your teeth for a long time because that puts you at a higher risk for gum disease and for caries or tooth decay risk. Okay. And of course, you've heard this before. Smoking is my worst enemy in what I do. It's really hard to treat these situations in smoking patients, of course. Smoking is like putting gas on a burning fire when you have these diseases because it accelerates everything. The nicotine gets into the tissues, constricts the blood vessels. It just causes havoc. And then people think vaping is going to be safer to some extent. That's not the case. Vaping is higher nicotine content. So it's actually the worst substance multiplied by 10 times. So no tobacco, no vaping. There's no point, even if you're primary immunodeficiency patient, even more point not to do it. Okay. When to seek care. When you have new ulcers, when you have persistent bleeding, you're trying your best, this is not working. That's when you seek help. That's why what I was telling you, look at the meter, take a look at your gums, learn to determine when they're bleeding because they're not going to be painful, right? Remember? So take a look at them, make sure that everything looks fine. But if you notice a little bit of bleeding, you go to the dentist, be very proactive. If you have an ulcer in your gum tissue, in your lips, if it's more like herpes and it's more like seasonal and you can control it, it's not a big deal. But if you have your ulcers in your gums, in your mouth, in the roof of your mouth, in your cheek, inside your cheeks, you should seek care immediately because they can be uh, prone to get more complicated and have complications after them. So be very proactive. Okay. So this is very collaborative care. You have to have the dentist, the periodontist, the immunologist. They're working as a team. They're going to be sharing information. Everything is going to be coordinated to your benefit. So make sure that you work with a good collaborative care team for this. And okay, we're approaching to the end. So these are the key takeaways. So as we have learned, primary deficiencies definitely increase oral vulnerability. They're going to make you more vulnerable to disease. Not the end of the world. We can treat them, but you have to be more proactive in your dental treatment. Prevention is going to be essential in these situations. Frequent monitoring can be very powerful. Get your dental cleanings every 3 months if you're having these conditions. It's so important to get your cleanings every 3 months when you're susceptible to gum disease. When I tell my patients I can do the surgeries, I can do the treatments, it's on them to maintain the results. I tell them now we have, we're married, right? And then we don't have the right for divorce. You cannot divorce me, I cannot divorce you because your condition, we don't get to cure your condition. We get to control your the condition, just like diabetes. We get to control diabetes. We don't get to cure diabetes. We get to control gum disease. We don't get to cure gum disease. So your constant cleanings, constant monitoring is going to be essential. Okay. With that, I want to thank for the opportunity and I'm really looking forward to your questions.
Mhm. All right. Thank you so much, Dr. Arce. That was incredible. I learned so much. I know our audience members learned so much. Um, and that was just an excellent presentation. So thank you so much.
Thank you.
All right. I'm going to pull my slides up again real quick. There we go. All right, everybody. So I know we have a lot of great questions already in the box. So we are going to go ahead and get into that Q&A. Just a quick reminder, we have some ground rules for Q&A, which have been shared in the chat that we ask you to respect those ground rules. And we're going to go ahead and get started with Q&A. All right, Dr. Arce, I think you touched on this here at the end, but just to really drill the point home, if for an individual with primary immunodeficiency, how often should they go for their dental checkups as compared to the regular schedule for a different individual?
I would suggest every 3 months.
Every three
Usually, what
months.
we tell patients, patients, immunoproficient patients, that it's good to see the dentist every 6 months.
Hmm.
But with PI patients, what I would recommend is every 3 months just to monitor. But patients need to become very good at also self-monitoring
Sure.
because remember, very silent. So they have to become very good at looking at their gum tissues, get like a mirror with light, so they can see very well and monitor the gum tissues and any early lesion that can happen. But I would suggest every 3 months would be better.
Sure. Thank you. All right, next question. Have you treated any individuals with PI who have successfully maintained their teeth into the later years of life? And if so, can you give some examples of, sort of what that trajectory looked like and how they were able to have success?
Yeah, so the most common situations that we treat patients are the innate immunity type of patients that have neutrophil dysfunctions. And these patients are treated in conjunction with the pediatricians because they also have to have the management with the pediatrician. And it's just constant monitoring, constant cleaning, but sometimes some teeth have to be extracted because the diseases can be advanced. And we've had patients in which we follow them for the rest of their life. As long as we can control it with good medical management, they can be affecting their primary dentition, but not so much in the permanent dentition because now we have better ways to do constant monitoring. When it comes to the innate immune patients, I haven't had the chance to treat a patient with IRT therapy yet.
Thank you. All right. So our community, as you can imagine, experiences a lot of hurdles dealing with insurance companies oftentimes. And this individual asked, do you have any tips for getting medical insurers to cover periodontal infections under their medical plans for individuals with PI? With the dental issues and treatment which stem from the immunodeficiency, how can we make that argument in order to get those conditions covered? Is that a battle that we can win?
Oh my gosh. Tough question. For whatever reason, we have a medical insurance industry and we have a dental insurance industry as if they had to be separated for whatever reason. Don't ask me why. I don't get it. It should be only one insurance to treat because it's not separated from the body. But just to answer your question, there's some situations in which you can appeal for something called medical necessity treatments. So the medical necessity has to be very well documented. And usually I've seen better results when you go through the hospital dentistry route because then the hospital-based dentistry is going to have better tools to bill medical insurance. So, for example, for me in private practice, billing medical insurance is extremely hard and very challenging. So in those situations in which you really need help from the medical insurance, my suggestion will be reach out to your hospital, local hospital that has a dental ward, like hospital dentistry, and they can help out work with with the physicians on the medical necessity part and documentation to treat these conditions. You're completely right. I don't get why that is the case.
Thank you so much, though. That's super helpful. All right, so I know you talked a little bit about electric toothbrushes in your presentation. So for someone who already has fragile gums and inflammation, can electric toothbrushes exacerbate those or make those conditions worse? Would you still recommend that for someone with pre-existing inflammation?
100%. It's
Okay.
like everything else, you have to learn how to use it. So, the first thing you're going to do is bring your power toothbrush to the dentist, and the dentist is going to train you on how to properly use it. Of course, if you go and use it in an incorrect manner and you put it on your gum tissue instead of your tooth, that's going to create problems. It's going to create a traumatic ulcer, and it's
Mhm.
almost similar to what the infectious ulcer is going to be like, right? So it's a matter of training, right? So, like everything else, an instrument that is used in an improper manner is going to cause problems. An instrument
Mhm.
that is going to be used in a proper manner is going to do wonders. But make sure you get trained on it. Many times we tell patients, yeah, go up and buy a power toothbrush and do it yourself. And you're trying to learn from YouTube videos and all that. No, bring your toothbrush to your dentist or periodontist, and they're going to explain to you how to properly use it. They're going to coach you use it, and they're going to supervise that you're using it well. And if this is going to be a new thing, my recommendation is that you use it for a week and come back to the dentist to make sure that you're not having any local damage.
That is a great suggestion. Thank you. All right. Scrolling through these. All right, so there is a myth in the immunocompromised community that root canals are dangerous or are not an option for someone with something like primary immunodeficiency. Is that true?
So, to be honest, I haven't reviewed the evidence
Hmm.
on that specific topic. I can definitely get back to you to make sure make sure we inform our patients regarding these situations. But overall, the issue with the root canals that they have bad rep, it's because they most people claim that it's impossible to clean the tooth from the inside, and we have years of evidence suggesting that that is not the case. We are able to completely eradicate infections from the root canals of the teeth of people having decay. But what is the regular problem? That root canal therapy is a very precise procedure and is not for everybody to do. I haven't done a root canal in 30 years. You don't want me to do a root canal on you, right? So there's an dental specialist specialty called endodontist. So your endodontist is gonna be very well trained in using microscopes to do your root canal, and they have the best technology to do your root canal. So a properly done root canal is very efficient and very safe way to control for local infection inside the tooth. So I will venture to say that even in primary immunodeficiency patients, that will be the case. The bad rep comes when the root canal is not done efficiently, because many times, I hate to say it, some dentists think they're doing root canal the proper way, but they don't find all the canals
Mm.
because they're microscopic and they don't have the technology. So they're gonna leave some infection in there, and then people are gonna claim it they're impossible to clean, right? Uh, Especially bioenergetic and holistic dentists. I don't want to, don't take this the wrong way. I'm not trying to bad talk about people and their beliefs, But we have to make sure we understand the issue as it is. It's a very complex procedure that has to be properly done to be successful. But root canal therapy works well when properly done. But I don't think primary immunodeficiency patients will be a higher susceptibility of failure. But just to be responsible, I will search that information.
Awesome, thank you. All right. We have a lot of folks also asking about or mentioning that they experienced dry mouth. Do you know if there's any sort of link between immune dysregulation and dry mouth?
Yes. So, for example, there's many conditions. I couldn't include all of them, right? But there's some immunocompromised patients with Sjogren's syndrome, for
Hmm.
example, or autoimmune conditions in which their glands are going to be destroyed. So, similarly, if you have immune dysfunction, your saliva production can be affected. And definitely, as we were discussing during the presentation, saliva is essential to maintain the health of the mouth. So if you're finding yourself with a dry mouth due to medications or due to your condition, seek help and monitor, constant monitoring, because you are even more prone to have decay and gum disease. So it's very important to be cognizant of the problem of saliva production. If you feel that you have a dry mouth, you even want to be monitored even more frequently than the 3 months. I would care to say month and a half to 2 months at least, just to make sure. When these patients have Sjogren's syndrome and they completely lack of saliva production, they get so much decay. It's so difficult to treat. But we do have some good fluoride systems that arrest the caries on very early stages, but these patients have to be on constant frequent treatment and monitoring and observation.
Thank you. All right. So this individual is asking, is periodontal disease considered a warning sign of primary immunodeficiency? They shared that their dentist had always assumed that they just were practicing poor oral hygiene, but really what was the cause of the underlying issues was the primary immunodeficiency. Would you consider that a warning sign?
100%. So this is something that is so important to do, is that never assume things that will happen in a normal way.
Hmm.
You always have to investigate. So I would never assume, oh, my patient never brushed their teeth. That's the reason why they're having this. No, there's always some signs that this doesn't look right. And especially if you pay attention to the type of inflammation, I can guarantee you the type of inflammation that you get in primary immunodeficiency is not the same as the type of inflammation or swelling you get to normal gingivitis. It looks different.
Hmm.
So that's why it's so important to have good detailed dentists that are going to be taking a look at this. Looks off, this doesn't look normal. And for example, for the kids, when they're babies, the first sign for this type of condition is the thrush,
Hmm.
right? They get candidiasis. So that's not normal. A baby shouldn't be having this.
Hmm.
So that's an immediate sign that we have to go to the physician and get some good labs to make sure, to count our neutrophils and leukocytes and make sure we're not having any primary immunodeficiency. But 100% agree, gum disease is an early sign for primary immunodeficiency conditions.
Thank you so much. I feel like that's probably validating for a lot of people too, so thank you for sharing that. All
100%.
right. We also have a number of folks asking about oral health probiotics and then also probiotic lozenges. Is that something that you recommend for your patients?
So unfortunately, they're kind of new and we have so many products in the market. So I have to say, last time I checked, the evidence is not super strong. Okay, so I cannot come here and say that, yeah, I'd use them. However, conceptually speaking, they can be beneficial. But my suggestion here is that if you decide to try, make sure you try with supervision and with your dentist,
Hmm.
because then you're monitoring that other things are not going to be happening. But I cannot tell you that that really is going to be something really, really good because we don't have the data to suggest so.
Sure.
But definitely, as we develop with science and scientific tools and probiotic development, they will have a place. They will have a better place in the future if they're not have a place already, depending on the situations. There's nothing that I can recommend out of my armamentarium of things that I treat patients with,
Hmm.
but they will definitely have a place in the future.
All right, thank you. All right, for this next section, we're getting a lot of questions about antibiotics. So I'm going to ask about some regular dental procedures, I guess, and you can let me know, are these something that someone with a PI would get antibiotics for? So lots of people get their wisdom teeth removed. Is that something that you would recommend antibiotics for?
Yes, and the reason for the antibiotics with wisdom teeth removal is that it tends to be a very invasive procedure, and it carries opening of the gums and removal of the bones. So it's a very intense surgery. So I do them frequently in my practice, and I prefer even in immunodeficient patients to even treat them with antibiotics in
Sure.
these cases.
All right. What about someone with PI who's just going in for their regular cleaning? Would you suggest antibiotics?
Debatable.
Okay.
So sometimes, if the cleaning is not gonna be intensive, we're not gonna have a lot of bleeding. We can try not to do it, because remember the problem with antibiotics is that they're also gonna be killing your good bacteria, and we want to have good bacteria to recover. Uh, but sometimes when we're treating patients for the first time, the immunologist is the one recommending it. We have to follow their instructions. So it has to be also a group decision as well. I wouldn't assume that it will be an automatic prophylactic antibiotic therapy for all patients.
Hmm.
So it can be a little bit debatable. It's on a per case, kind of per basis needed,
Sure.
basically.
Sure. But definitely worth having a discussion with your dentist before you go in for that cleaning.
Correct.
All right. So what about for some of the more common dental work that people get done, like fillings or crowns?
I would say no
No.
needed
Okay.
for antibiotics because those procedures should be far away from the gums. The gums are the bloodiest, tissues in the mouth.
Hmm.
Teeth, on the contrary, the blood in the teeth is very deep. If you have blood, tooth bleeding, then you're in trouble. You're in a root canal. So fillings, things like that, you shouldn't be needing antibiotics.
Okay. Good to know. All right. And then my last antibiotic related question for now. If someone has a tooth abscess, what antibiotic do you recommend? And then what else, what immediate action can they take to address the abscess?
Yeah, so abscesses are very important. I wish I would have included some more information about abscesses. So I'm very happy to answer these questions. The problem with abscesses is that when they collect, they accelerate the infection so much that they can knock out a tooth immediately. It's crazy. So I definitely recommend in localized periodontal abscesses to use antibiotics as
Sure.
part of the treatment. Your periodontist will sure do it. Now, there's some abscesses that are not periodontal, they're gingival, and they're very localized. Sometimes they happen because there's food impaction.
Hmm.
The typical situation is that you eat popcorn, a little kernel gets stuck in there, and you couldn't clean it, and then
Hmm.
you get a little abscess in there.
Hmm.
You shouldn't be getting antibiotic for those because
Okay.
those are self-limiting and they're not a big deal. But if you get a bigger abscess, you have to go to dentist. They're going to take a radiograph. We have to see the extent of the destruction with the radiograph, and the debridement together with antibiotics is going to be very important.
Sure, sure. Thank you. All right. I want to be mindful of your time, Dr. Arce, so we're going to just do a couple more questions and we're going to close out for the evening. But we have a ton of folks in the comments who are mentioning that they have issues with gum recession. So are you aware of a connection between immune dysregulation and gum recession? Is that something that you see or that you've heard about in patients who are immunocompromised?
No, I don't think there's
No.
evidence to suggest that they're related, but I'll
All
tell
right.
you what happens with recession patients. So you can either have recessions following bone loss or gum loss. So patients that have had gum disease will tend to have teeth, longer teeth, because they've lost a lot of bone. And with
Okay.
that, the gum tissue has followed the bone. So we jokingly say in dentistry, the bone sets the tone, the tissue is the issue. So when you say the bone sets the tone, is that the gum tissue will always follow where the bone is. Now, you may have not had any periodontal disease in the past, but you're starting to have recession. That happens where you're immunodeficient or proficient, and usually it's related to patients that had orthotherapy when they were younger. And what happened is that they expanded the teeth because they wanted to accommodate the teeth with your ortho braces, and
Hmm.
they expanded the teeth so much that they thin out the bone in that area to the point that it gets so thin out that it resorbs a little bit and the gum tissue follows. So usually when you start having recession in the absence of gum disease, you have to question yourself, was this because my orthotherapy? And then you have to go to the periodontist and see what kind of options we have to address those. But I think that primary immunodeficiencies are more affecting towards like the infectious immune swelling process.
Hmm.
When it comes to recession, as long as there's good plaque control and all that, it's not gonna get any worse, and it
Okay.
is treatable.
Okay. Okay. That's very good to know. Thank you. All right. Well, I think this is going to be our last question. But I just wanted to share. We have so many questions in the box. I can't even scroll through them all. But a lot of it is also supportive comments from our audience, thanking you so much for this wonderful presentation tonight, and saying that they wish they could have you as their dentist.
Oh.
So while we know that's not everyone's in Texas, so it's not possible for everyone here. What sort of advice would you give to folks who are looking for a dentist who they're wanting someone who's knowledgeable on primary immune deficiency, or they have experience treating patients with immune dysfunction? What advice would you give?
Well, the first thing is to have an honest conversation, and of course, many times dentists get so much focus on their clinical training that they get a little bit uncomfortable with medical complex situations,
Mhm.
right? So it's very good to have an honest conversation with your dentist and say, hey, listen, I have this condition. This is what we did. You also, as a patient, you can educate your dentist. And these are the things that we have to take. Would you be willing to work with me, or would you be feeling more comfortable if I go somebody else that you can refer me to?
Sure.
And I think an honest dentist will say, yes or no.
Hmm.
If they don't feel comfortable because they don't have either the knowledge or the equipment or the capacity to make sure they're doing these protocols for high disinfection of the areas and all that, nothing wrong with saying, I think you're going to be better suited to other type of situations. Okay.
Sure.
If that's the situation, I would recommend that people seek more like hospital-based dentistry.
Hmm.
There's something called GPRs. These are graduate practice residency in dentistry,
Hmm.
GPRs
Hmm.
in hospital-based dentistry. They are experts in treating immunocompromised patients and medically compromised patients in a hospital setting. And
Sure.
sometimes hospitals have better ways to prepare for these type of situations.
Sure.
So if you haven't found a dentist that is comfortable with treating your diseases,
Hmm.
then go to hospital-based dentistry. University hospitals and all that will have this. Always Google GPR, and they will have those programs
Hmm.
that are, dentists undergoing a specialty training, treating medically compromised patients, and you will be very good at those places.
Excellent. Thank you so much. I bet that is super helpful for a lot of our folks joining us tonight. So thank you. All
Mhm.
right, well, we are going to go ahead and conclude our Q&A. So, Dr. Arce, thank you so much for answering everyone's questions. Thank you to our audience for submitting such thoughtful questions. I know you likely have a dinner you want to get to, or just you want to get on with the rest of your evening, Dr. Arce. So, if you are going to be leaving us now, that is totally fine. For the rest of the folks joining us, we'll just close out with a couple of quick resources and upcoming events. But I cannot tell you how much we appreciate your time this evening. This talk was incredible. There's no one else we would rather have had, giving our first PI and dental webinar. So thank you so much.
That's so nice. Thank you so much. It was wonderful to be with you guys.
Thank you so much. All
Bye.
right. Have a great rest of your night. Thank you.
Thank you.
All right. So, to our audience members, we're just going to share a couple of quick resources before we close out. I want to be mindful of the time and let everyone get back to their evening. PrimaryImmune.org is your go-to website for additional resources, upcoming events, and more. All materials are free to access, print, or have mailed directly to your home. And if we didn't get to your question during the program, you can contact our board certified patient navigator through our Ask IDF program. She will personally connect with you to tackle your question and direct you to appropriate resources. You can even take the Immune Deficiency Foundation on the road with our engaging podcast series. You can find programs like Bold Conversations, Undiagnosed, and Chronic 20s. Simply search for the Immune Deficiency Foundation podcast wherever you get your podcasts. And we also have a YouTube channel where you can find recordings from all digital education initiatives, and tonight's program will be available in the new year. Find a safe and supportive environment to link up with others impacted by PI through our Get Connected groups. These groups are free, virtual, volunteer-led opportunities to connect with others with PI all over the U.S. We offer location-based groups, so in your city or state, diagnosis-specific groups, and nationwide groups, and because we meet virtually, you can really join any group that works for you. All upcoming meetings are listed on our calendar of events, and we'll share the link to that in the chat right now. We also offer facilitated support groups for young adults. We have ones for parents and caregivers. We have one for spouses and partners. And then we also offer a peer support program if you're more comfortable with something that's one-on-one. If you're feeling the weight of isolation this holiday season, please know that you're not alone. Our Get Connected crew will be hosting a virtual holiday gathering on December 25th, offering a place for genuine connection and shared understanding. You're welcome to come as you are, show up just as you are, and if it's in your PJs at home, that's totally fine. Whether you are choosing to celebrate, you're just using the day for rest, or you just want to connect with others from the comfort of your home, we're happy to have you join us. And if you visit the link in the chat, you can go ahead and register for that gathering. And tonight is our final program for 2025, but we do hope to see you back in the new year for more great programming. In the meantime, registration is now open for our 2026 National Conference, taking place next June in San Antonio, Texas. Scholarships are available and applications are open through March 31st, 2026. And in case you missed it, the Immune Deficiency Foundation is now part of Walmart's Spark Good Roundup campaign, where customers can round up their purchases to the nearest dollar and donate the change to their favorite charity. All you have to do is visit walmart.com/sparkgood, search for the Immune Deficiency Foundation, and sign into your Walmart account. From there, you can donate spare change by automatically rounding up your orders to the nearest dollar at checkout. All right, we are now going to launch our closing poll. Again, we're going to give about 30 seconds for everyone to answer. And our closing poll tonight asks, after tonight's program, please rank your level of awareness of how immune dysregulation impacts dental health. All right, awesome. Well, thank you everyone for your responses. I am so happy to see that everybody learned something tonight, and I know I did. So thank you so much, everyone, for your feedback. All right. And now we're going to invite everyone to share one new thing that they learned from tonight's program. So if you will, go ahead and we're going to use the Q&A box for that. So go ahead if you want to type in one new thing you learned or something you liked about tonight's program, put that in the Q&A box and we'll take a few moments to read some out loud. And we really appreciate this feedback from you guys. All right. Just lots of folks expressing appreciation. We appreciate you as well for joining tonight. Someone mentioned that they need to get a water flosser. That was definitely a good one to learn about. Periodontal disease isn't curable but needs careful management. Definitely a key takeaway. Um, I thought it was very helpful too that he shared that folks who might be immunocompromised could go every 3 months instead of every 6 months. I thought that was a great takeaway. Uh, Someone put that the bacteria are having a party in my mouth while I sleep. That was also a nice visual from tonight's program. Some folks saying that the flossing is even more important than brushing. That was definitely eye-opening for me. Folks appreciated the information about hospital dentistry. Lots of people talking about that. Just the people who are, their eyes were open to the role that the immune system plays even in other parts of the body, better understanding of dry mouth and bacteria. So this is great. It looks like people learned a lot tonight, and I did as well. So thanks everyone for sharing, for what you took away from tonight's program. That's awesome. All right, before we go, we want to give a heartfelt thank you to our amazing volunteers and supporters who make programs like this possible. If tonight's presentation resonated with you, which we hope it did, we hope you'll consider supporting future programming here at the Immune Deficiency Foundation. Your donation at any level helps us continue building community and delivering meaningful content like tonight's program. Thank you so much for being here. All right, a big thank you again to Dr. Arce for joining us this evening. We so appreciate you leading this important discussion tonight. He and I, in our planning meetings and everything, I really emphasized that this was a highly requested topic from our community, and we really consider it an honor being able to host him here as our first clinician to cover it here through the Immune Deficiency Foundation. So thank you so much, Dr. Arce. I am going to leave the Zoom platform up for a few minutes just in case anyone wants to check out the links that we shared in the chat. But thank you everyone for joining us tonight. And on behalf of the Immune Deficiency Foundation, we wish you a happy and healthy holiday season. Thank you so much for being a part of our community and take care.